Hey, DNA. I'm Kate Wilson, the host of All Access DNA. In today's episode, we are talking to Kevin Alexander, him, about newborn screening and phenylketonuria, or PKU. On April 3rd, 2025, the Trump administration and Secretary of Health and Human Services, Robert F. Kennedy Jr., terminated an essential committee for newborn screening without warning. I talked to Kevin about what this means for babies and adults like him living with a condition picked up by newborn screening. We discuss the impact of newborn screening, and he shares his personal journey, as well as stories of families with rare disease. Kevin Alexander is an adult living with PKU. He's also a filmmaker, and since 2012 has been traveling the world as a PKU, newborn screening, and rare disease advocate. Let's get started. Hi, Kevin. Welcome to the podcast.
Hi, thank you for having me.
I'm so glad that you're here. First off, I was hoping you could tell us a bit about yourself and explain some more about PKU.
Yeah, sure. So I'm Kevin Alexander, and I'm a professional storyteller, background in broadcast journalism, currently work in commercial video production. But I'm also an adult living with PKU, or phenylketonuria. I've been involved in PKU advocacy for a long time now after producing a YouTube film called My PKU Life. And I've just been involved in various parts of newborn screening and PKU advocacy ever since. I was diagnosed with PKU when I was 9 days old through newborn screening. And PKU, or again, phenylketonuria, it's an inborn error of metabolism that's caused by a mutated gene. And so my body doesn't have the ability to process or metabolize a particular amino acid in protein called phenylalanine. And so if it's not diagnosed at birth through newborn screening, it leads to lifelong developmental delay and possibly institutionalization.
That was a very good, succinct summary because I will say it's been since graduate school, probably since I had many conversations with folks about PKU. So,
Yeah.
a good refresher for myself as well. You mentioned that folks with PKU can't process phenylalanine. And some folks may or may not have realized that there are many food, drink products that contain phenylalanine. So you can look
Yes.
like on a can of soda and it will call out contains phenylalanine. Can you tell us a bit more about the PKU diet or what folks with PKU eat or have to avoid?
Sure.
Yeah.
Yeah, so actually, these days I refer to it now as dietary therapy because over the years, it used to be called the PKU diet, and we still refer to it as the low protein diet in the PKU community. But other medical professionals in the PKU community call it dietary therapy now to emphasize that it's not a lifestyle choice. When you typically think of the word diet, you think that it's an option, that it's a choice. And I like to say that with PKU, the choice is between brain damage and no brain damage with every single piece of food I eat. So phenylalanine is one amino acid that's in protein. Now, you mentioned like diet drinks and different things. That's because aspartame, the artificial sweetener aspartame, has a highly concentrated portion of phenylalanine in it. So we have to avoid, any diet drinks, most diet drinks, because if they have aspartame, we have to completely avoid that.
Mm-hmm.
But because it's in protein, and protein is literally in everything that we eat, in everything, people with PKU have to be very, very diligent about their diet and avoiding higher amounts of protein. And the way I like to describe it is it's kind of like a range of tolerances. Most people who have PKU can tolerate about 4 to 8 grams of protein in a day.
Okay.
And as a point of reference, one slice of bread has 4 grams of protein. So one sandwich exceeds,
Right.
the average person's capacity. And so that's on the lower end. There's some even more, lower than that, anywhere from 1, even less than 1 to 4 grams. But also there's a wider range, and there's some people who are upwards of 20 grams of protein. There's different forms of therapy or treatments out now for PKU. And so I happen to be on one that allows me to eat 50 grams of protein in a day, which is close to a normal diet. And there's other people who take an injectable shot that allows them to eat completely unrestricted, except they have to keep doing the medicine every single day. But practically what this means, though, is a lifelong vegetarian diet. Mm-hmm. But even with that, even vegetables have protein. You think of beans. Beans are highly concentrated in protein. So for many people with PKU, what this involves is a low protein diet to restrict the amount of phenylalanine in the natural diet, because you have to have some protein to survive. So there's special medical drinks that we drink that are they're high in protein but have that amino acid removed, and that's a
Okay.
staple of the diet. And then on top of that, especially for people on the lower restriction, there are special foods that are created medical foods. They're classified as medical foods, and they're created to be low in protein. So, pastas and breads and different things like that are made to be low in protein, which is a huge part of most people with PKU in their diet.
And I had not heard the term dietary therapy, but I think that makes a lot of sense to refer to it as that. Can people who have PKU ever go off this dietary therapy? It sounds like there are medications that allow a range, right? So people that might be on these medications may be able to have more protein, or just some folks with PKU also just naturally without medications may have a range, I guess, of protein amount that they can have.
Yeah, so the short answer is no, this is dietary therapy for life. And
Okay.
in fact, but I'll briefly kind of establish the history of that because that wasn't always the case and wasn't always the understanding. So,
Hmm.
newborn screening, I know we'll get to this later, but newborn screening began in the 1960s. And until probably the late 70s, early 80s, it was thought that you needed to, once the child was about 5 or 6 years old, that you could take them off the low protein diet and let them eat normal because their brain had fully developed by that time. Now we know that cognition is developing much, much later and all the way through life.
Right.
But so as time went on, it started at, well, we'll take them off diet at 6 years. And then it was a little bit later and a little bit later. When I was growing up, I was told that maybe when I was an adult, maybe then I could go off the diet. But by the time I became an adult, I was told the new phrase at the time was diet for life, diet for life. And there was an
Hmm.
understanding that this is something that we have to do every single day for the rest of our lives. So even in the case of someone who is taking the shot, the medication, pill like I take, or someone who's just doing the low protein diet and medical drink and low protein food, it's all for life.
And because it is this dietary therapy, and you mentioned the drink that has is able to get the protein right that people need, but without the phenylalanine, is it like does insurance cover this type of treatment?
That is the one of the biggest issues in the PKU community is that
Hmm.
because of insurance laws in the U.S., it really depends on what state that you're born into and what state you live in as far as what coverage you can get. I happen to be in Louisiana, where there actually is support for the medical drinks that I have to drink. But if I literally lived over next door in Texas, I wouldn't
Hmm.
have that. And it's as one of someone I interviewed once said that for her, it's like having a second mortgage that she has to pay every month because it's extremely
Yeah.
expensive.
Yeah. I mean, I would imagine, I think about folks that have like newborns that are on like sensitive formula types of things, and it's a very significant amount of money just to be able to provide something, that people need to live.
What I think is really interesting is the medication, the pill that I take, which has absolutely changed my life. It is about $17,000 a month.
Wow.
But the medical drinks are not nearly as, they're still expensive, but they're not nearly that much. Insurance will always cover the medication. They will not
Huh.
cover the drink. And it's just because of the way things are classified, and it's
Right.
just a very, very confusing and frustrating subject.
Yeah. Yeah. And unfortunately, the insurance it's not black and white, and it's convoluted in a lot of ways. So it's challenging sometimes to figure it out, and I think it's good to note that there is that difference in state law. So it's not a federal thing at this point. It just depends on where you live as to what would be covered. You mentioned that you were diagnosed with PKU at 9 days old, and that it was a part of newborn screening. So is that typically how somebody would find out they have PKUs, through newborn screening?
Yes, in almost every circumstance, it's newborn screening that detects it because the longer that process is delayed, the more damage that's being done to the infant at that time. So basically, what happens, and to illustrate why it's so critical, is someone with PKU, they have that faulty gene, that mutated gene. When they consume phenylalanine, it can't metabolize, it enters the bloodstream, has nowhere else to go but go into the brain and cross the blood-brain barrier and causes brain damage. And so in an infant, if that keeps building over time, then it leads to severe cognition problems, severe developmental delay, and enough time goes on and it's irreversible brain damage. And so it is absolutely critical that it's detected within the first few days of life. So if it happens much later, it's typically because newborn screening wasn't performed, which happens in other parts of the world, and even some places here in the U.S. I've heard of a few cases here and there. But when that happens, it's typically too late to avoid the consequences of irreversible brain damage.
Okay. So the damage has already been done by that point and you can't really reverse it. Tell us more about newborn screening, since that
Yeah.
is, PKU is just one of the conditions it screens for.
Correct. So newborn screening itself is not just, so there's the method that detects PKU and other rare diseases is one component of newborn screening. So there's the blood spot test for newborn screening. That's what I'll talk about. I will briefly mention that there also is hearing screening and screening for critical congenital heart disease. Those are aspects of newborn screening that's not really part of my advocacy. I'm not as much of a, it's not my expertise. So
Hmm.
those exist, but I always focus on the blood spot test for newborn screening, which was created by Dr. Robert Guthrie in the 1960s, late 50s, early 60s. And it was just it's a simple collection method where, a heel prick for the baby, get a sample of blood, put it on some filter paper, and that's sent off to the lab. So his vision was clear. Newborn screening should be timely, accurate, and comprehensive. And so that process is very, very simple. And I'm a big believer that with newborn screening, whatever works here in the US, also has to be possible for someone else in other parts of the world that may not have the resources the United States has. So newborn screening itself, the heel prick test, the blood spot test, it is a very, very simple collection method that can then be sent off to a laboratory to run the higher end results. But basically what happens, it's not just one test, it's really the newborn screening system.
Hmm.
Because the process begins in the hospital when a nurse gathers the sample, and then the administrators send it off to a laboratory, and then typically a state laboratory. And the
Right.
workers at the state laboratory will process those samples and confirm a diagnosis. Of course, there's those who manufacture the machines that they use, mass spectrometers they use to actually run the results. Then there's, the medical professionals at the genetics clinic in the case of PKU that the state lab will reach out to and let them know, hey, we have a diagnosed case of PKU. So that team can then reach out to the family and let them know. And so that's this entire chain that is critical for everything to function properly. It's not just this one test.
Right. And it's a time sensitive test, as you mentioned, right? Because there are some conditions that, if not detected soon enough, there could be irreversible damage challenges that come up from it. I don't think people realize maybe the full ecosystem, right, that goes into newborn screening. So, like you said, typically it is a state run lab, and there's protocols, processes in place where they can run the test, typically on a mass spectrometry, which isn't necessarily doing the in depth gene sequencing, right? They're looking to kind of say, hey, who do we need to take a closer look at? Bring them into the clinic. Let's do additional testing if needed, versus who is not at this risk at this point in time. So that's why it's a screening and not a diagnostic test.
Right. And so I know that a lot of times, and I've heard these stories over the years of, the frontline medical workers, the nurses who are gathering these in their careers, most of them will never see a case of PKU. Same thing with most pediatricians. They will never see a case of PKU. Like, most people, their memory of PKU is what they read in a medical textbook in medical school, and then they never had to learn about it afterwards because they never encountered it. And there's a phrase that we use in the rare disease community, and of course it's a reverse. Our mascot is the zebra, because in the medical world you're told not to think about the zebra, you're told to think about the horse. Well, the problem is we are zebras, and so often what happens though is the test will be run, and because they never come across a true positive case, they deal with a lot of false positives. And so many people just think of it as, all they think about is the false positive, the false positive. And unfortunately, there's those families out there that need to know for certainty that it actually is a true diagnosis and it's not just a false positive. And the consequences are unfathomable for most people.
Right. And that's the thing is as you mentioned, it is a simple blood test. And when I think about it, amazing that something that is a public health initiative that was able to be offered in the 50 states, right? That this just kind of came up and said, hey, we can do this. We can do this in a simple way. And we can try to get the people that need the care as soon as we possibly can. So, it's a fairly large undertaking and something that we've had, I think, what did you say, since the 60s?
Mm-hmm.
Yep.
Yes.
So it goes off to the state lab. So people will then come back and then they may have an official diagnosis. Do you know some of the other conditions it screens for besides PKU?
Yeah. So off the top of my head, so I used to be on the board of the Louisiana Metabolic Disorders Association. I'm now just a volunteer with them, so I've had connection. So that group is not just PKU; it's other metabolic disorders, and so other families that I've encountered are tyrosinemia types 1, 2, and 3, maple syrup urine disease, MSUD, homocystinuria, HCU, various fatty oxidation disorders, urea cycle disorders. I mean, that's just a handful.
Right.
But I want to say there's actually 64 conditions that are on the recommended list for newborn screening in the U.S.
It does vary by state. So it's another thing where it's state dependent. Some states may only test for X number, some may test for X plus Y. So it just depends. So folks would have to actually look up to see what their state has as part of their newborn screening panel.
Yes, correct.
Okay. One of the things I did want to get into is recently, so it was April 3rd, the current administration under President Trump terminated what's called the Advisory Committee on Heritable Disorders in Newborns and Children, pretty much without warning. It was a big news, I think, for those of us involved either in the rare disease community, those of us involved in genetics, but I don't think many people in the general public heard about it or maybe even understand what this means. So maybe you can give us some background about what the committee does.
Okay, sure. So the ACH-DNC was a committee of volunteers. These are medical experts and patient family advocates, and their job was to make recommendations about federal newborn screening policy. And one of the most critical elements of their work was producing what's called the Recommended Uniform Screening Panel, or what we call in the industry the RUSP. And it's a guide that's used throughout the United States regarding which rare diseases should be included in newborn screening. And as you said, every state is different, but this list is like the standard of saying this is what we recommend for. Some states will screen for a certain amount, but not all of them. Some will screen for, I don't know if all of them, but a majority of them.
Mm-hmm.
I'm not up to date on every single condition that's on the RUSP and what
Mm-hmm.
states are screening for. But the critical component of this, though, is, and I think the best way to illustrate why this is such a loss is, I have PKU, and PKU has been screened for in the United States since the early 1960s. 1963 was the first year newborn screening was adopted in the U.S. in Massachusetts, and it was for PKU. Was literally Dr. Robert Guthrie, who created the blood spot screening test, created it because he ended up having a case of PKU in his family. And he created this test because he understood that by the treatment for PKU had already been proven in the 1950s by Dr. Bickel and his team at Birmingham Children's Hospital in the UK. And so they knew that if they could actually intervene and detect this early in life and then put that child on a low protein restricted diet and this metabolic formula or medications, I call it, they knew that they could prevent the worst outcomes of PKU. So he created this test, and ever since then, PKU has been screened for in the United States. However, there are other rare diseases out there that, and just to give a few statistics on rare diseases in general, I mean, you're talking about 10,000 different rare diseases affecting 400 million people globally. And these statistics are from the National Organization for Rare Disorders, or NORD, and they released these a few years ago at their Rare Disease Week event in DC. 95% of all those rare diseases have no approved treatments. PKU does. We're one of the 5%. 50% of people in the US who have a rare disease are children. And 30% of all children living with a rare disease will not survive past the age of 5. In the grand scheme of things, there's 64 different rare diseases on the recommended uniform screening panel, but there's 10,000. So, a lot of times what happens, especially in the PKU community, and I've seen this a lot over the years, and this used to be my life story too, before I got involved in advocacy, I was only familiar with my life experience. And for me, PKU was a positive story. It was a positive event, and I knew that it changed my life. And then as I started meeting people throughout the PKU community, I'm seeing these are people whose lives were changed as well. But for all these other rare diseases out there that exist that aren't on newborn screening, there is no positive story from newborn screening. Maybe their child actually does receive screening, but not for their condition, so there's no intervention. And so there's a case of this that shows what advocacy can do, because so back in 2013, I participated with the Association of Public Health Laboratories, or APHL. They had a newborn screening awareness event on Capitol Hill, and I spoke on a panel, and for the first time I heard the story of Krabbe disease. Jim Kelly, who was NFL football player, his son died from Krabbe disease, and that community advocated for years to be included on the recommended uniform screening panel. In 2024, they were finally included, and there's a mother who, besides Jim Kelly, he gets a lot of attention because of who he was, but there's so many people out there who are fighting for their children that didn't survive. And so there's a woman in Pennsylvania who lost a daughter to Krabbe disease. And after she lost her daughter, she kept fighting to get Krabbe disease included. And again, in 2024, that community was finally included on the recommended uniform screening panel. But their rare disease was added. There's a whole other list of other rare diseases that were awaiting appeal to be included on the RUSP. And now with the suspension of that committee, there is no path for them to be included. So they're not going to be added to federal newborn screening policy.
I think some people think, oh, these public institutions, newborn screening, it's been around since most of us, have also been around. It's never going to change. And what people don't realize is that we continually learn about new conditions. We continually improve testing to be able to pick up some of these conditions at different stages. So it's always evolving, it's always changing. And so if we don't have a way to continue to update the RUSP and to update newborn screening, we're not going to be able to apply any of the knowledge that we come up with.
Yeah, I mean, it's, even after this news happened, and I shared about it on Facebook, and then I wrote an article that I shared on my website. As I was talking with people, even in the PK community, I think there was some misunderstanding over what newborn screening is, because people just think of it as the test. And through my advocacy work, I've been able to meet a lot of people who work in the field of newborn screening, whether they work for the manufacturers who make the mass spectrometers or they work for the public health labs. And it's special to me and it's special to them because they don't get a chance, especially the lab workers. They don't get a chance to meet someone whose life has been affected by their work. And so it meant a lot to them for them to see another human being whose work they're impacting, their life is impacting. And so, but I heard a lot of people only focusing on the test. It's not just the test; it's the entire system, and the system needs to be constantly maintained and improved so that, for example, the machines that one state laboratory might be using, maybe the machines are calibrated and working well on Monday, but what about on Friday? They need to, the system needs to be maintained to keep things going. And unfortunately, I think this policy is extremely destructive because it's slowly going to erode the newborn screening system in the U.S.
Have you had a chance to hear back from folks that work kind of within the newborn screening process and what some of their concerns and fears are?
I mean, yeah, the main thing is that my fear all along is that for many years since I got involved in advocacy was because newborn screening was not part of the popular consciousness, that it was going to be the kind of thing that could be distorted some way someday for ulterior motives. Personally, I think that's what's happening. I think it's distortion that's not based on fact and reason. It's based on fear. Mm-hmm. And the unfortunate reality is that is going to have very, very real world consequences. And I have heard from people who work in that field, whether I mean, I don't want to say what agencies, but I have heard from people who are saying that behind the scenes it is not good, and
Yeah.
it's going to be destructive for the long term newborn screening system in the country, and for
Yeah.
public health, and for public health in general.
Yes. Yeah, I think that's one of the biggest fears I continue to hear is public health and some of these, again, these programs that have been around for decades that work and are proven to work and do make a difference can mean life or death to an individual, you know? And so I think it's extremely chaotic time. I think a lot of people are feeling a lot of uncertainty. You gave us a few examples or shared some stories about some folks with rare disease. Do you have any other stories that you can share about people that have been impacted by newborn screening?
Yeah, the first I'll have to start with is in 2013. So my advocacy began when I produced a short film that was just telling my story of living with PKU. But at the time, I was not connected to what the PKU community. That's what I mean, we have a very, very real online and in-person community for that matter across the world. Every single day, I am chatting with other adults who live with PKU. And it is a very, very meaningful, real connection. Some of these people have become my closest friends and friends like family. And it's been through social media, through attending events, and then just getting together and hang out. But so we all have this life that we have because of newborn screening. It changed, I mean, newborn screening literally changed a generation for the good. But in 2013, after I had been interacting with the community, I told a story. I produced another film. It's called For Katie. And it's about a girl named Katie Hayes. And she was born in Mexico, and newborn screening was not a requirement. And her parents were US citizens, and they were living there at the time. And they were given the choice in the hospital of whether or not to do newborn screening. But as her father puts it, it was not communicated as if there was any urgency whatsoever. It was like, hey, you can have this amenity or this amenity. You can have this option or this option. And oh, by the way, there's this test. We're like,
Hmm.
what test? And they said, oh, it's not really that important. They always come back fine anyway. So he chose not to get newborn screening. And I produced this film in 2013, and his words never, ever, ever left my brain. He said, in every story, there is a villain. And unfortunately, I became that villain in the story because he chose without the proper information. And that choice meant that his daughter had PKU, and she was not detected. So months went by, and she was showing developmental delay, and they could not figure out what was going on. They'd taken her to the doctor and taken her to the doctor. They couldn't figure it out. Eventually, they ended up running a test, and she came back positive for PKU. And she was 13 months. And by that point, she'd experienced severe brain damage and has been had lifelong developmental delay. I produced that
Hmm.
in 2013. Today, she's about 19 or 20 years old. She lives with her family. They do a great job taking care of her, but she will never be independent. And it's the story of people who were born in the 50s and 60s, or born in the 40s and 50s, or even long before that when nobody knew what PKU was. But the only difference is that I received newborn screening and she did not. And I can have this conversation with you and she can't.
And that is a very powerful story. It's heartbreaking to hear the dad describe himself as the villain. And I think that is very challenging. So prior to doing this film, you hadn't considered yourself an advocate. So I guess what changed for you after doing the film for Katie?
I began to understand that not every newborn screening story is a positive story.
Hmm.
Um, it is, and sometimes it's really hard for me to explain in the PKU community because most people with PKU, I mean, I've been doing PKU advocacy for a long time, and become visible in our community. And so I talk with a lot of people, and I get people talking with me who don't share their stories with other people. And so they may not hear those stories because they're connecting as adults, and they're encouraging each other in their daily lives, and they're encouraging each other to do the things we know we need to do, follow our PKU treatment and drink our medications. And, one of the things we have to do is take these do blood tests. That's the only way that, even as an adult, that I can know how well I'm doing is to take a blood sample and do that. And they run it and make sure that the levels come back okay. And, or, being in an Instagram chat group and people talking with each other all day from all over the world. But I just happen to get a lot of people reaching out to me that tell me the other stories too.
Mm-hmm.
And not just in the PKU community. I mean, the PKU story, when you're not diagnosed, I mean, it's bad enough, you know.
Mm-hmm.
And I'm not saying that as a way to demean someone like Katie, because her life is just as precious as anybody else's who was treated on diet since birth and all that. But there is a very real consequence at the same time that her story was avoidable.
Right.
But that story is typically disability, in many cases institutionalization. That's that story. With other rare diseases, it's fatal. And so a few years ago on Facebook, June 28th is celebrated both as PKU International PKU Awareness Day, but it's also celebrated as International Newborn Screening Awareness Day. And so one year, a couple years ago, I shared a photo of Dr. Robert Guthrie and was talking about, hey, in a few weeks in the U.S., we have a organization that I service called the National PKU Alliance, and we're having a conference. And I said, we're all going to be gathered at this conference, and we're going to be people who were impacted by newborn screening, and this man helped save our lives. And someone commented, and she basically said, please remember those of us who don't have the same story with newborn screening. And her
Mm-hmm.
daughter was born with maple syrup urine disease. And newborn screening was done, but the hospital batched the sample. So often, if a child's born on Monday, to save money, they might save that sample until later in the week and then send all of that week's samples at the same time. But in a case like MSUD, it is extremely timely and critical that result come back as quickly as possible. As a result, her daughter was diagnosed with MSUD at 10 days. I was diagnosed with PKU at 9 days, and that wasn't a problem for
Mm-hmm.
me. She was diagnosed with MSUD at 10 days. It was too late, and her daughter died. And
Oh
newborn
my
screening
gosh.
and newborn screening was performed. So again, it's not just whether or not the test is done; it's about the entire system working properly to save lives.
Mm-hmm. And I think that illustrates the point that, okay, so we now don't have this advisory committee. What happens in those cases, right? There any oversight left in terms of, are people being identified in time or how to improve the process?
So I mean, there's first of all, there's a lot that's not known because the way this news circulated was that a letter was sent to the committee members, and that was circulated in the community on social media. But that was the only information that was provided. And since then, all I have seen is statements from different organizations who are commenting on it, but no new information other than what was initially released. And in that letter, it acknowledged you have questions, we don't have answers.
Yeah.
So there's not any information being shared. So it's not a matter of spreading fear or misinformation, which frankly I've been accused of since I wrote my article and shared about what was going on. It's not that. There is no information. And the lack of information, in this case, there was not thought put into this about how to communicate this, about what are the consequences going to be because of this. And so here's what I know. Is newborn screening going away at the state level? No. But to make that the subject is twisting what the conversation is about. It's not
Right.
about whether or not newborn screening is being done. It's about how effective is that going to be long term. If the system breaks down and there's no way to make sure, again, Dr. Guthrie's legacy was timely, accurate, and comprehensive. Well, that comprehensive part is about adding new rare diseases to the newborn screening panel. Comprehensive is making sure that it's not being done to just one condition like PKU, but it's being done to the whole batch of things that are on the recommended, uniform screening panel. And then, of course, timely. Is it being done in a timely manner? Well, again, in this case of the daughter with MSUD, it was done. It just wasn't done in a timely manner.
Right.
So there's
Right.
all of these aspects in the system that have nothing to do with what happens at the state level. Nothing.
Mm-hmm.
And I wish I could say I have any answers, but I don't.
No, I mean, I think a lot of us wish we had answers. And I think to your point, there is an alarm, right? I think it is very concerning, especially like I said, again, for those of us that work in this space. And that's part of I think wanting to get out there is trying to say for folks that work in the space, we're aware of it. We know about the conditions, we know about newborn screening, but the vast majority of the public doesn't realize it. And so we could be seeing fairly significant consequences 5, 10, 15, 20 years.
Mm-hmm.
And that's unfortunately when some people might realize how impactful this decision is.
Yeah, yeah, and that's why I think the only thing I've been asking this question a lot recently. I was talking with one of my friends just last night about it. It's like, what do we actually do?
Yeah. And that was actually going to be my next question is like what can
I
can
mean,
folks do that want to advocate for at least newborn screening or try.
of course, the number one thing is, and the obvious answer is, reach out to your congressional leaders, right? Whether or not you
Mhm.
think that does any good or not, at the very least, you can say that you've done it and you checked off that box. To be honest with you, I've been involved in advocacy for so long, advocating for issues involving, affecting the PKU community. And I just personally don't feel like that process helps me very much because I frankly do not feel like I'm listened to. I can walk into
Mm.
their offices on Capitol Hill, look them in the eyes as a human being, and tell them this is what's going on, and I do not feel listened to.
Mm.
Period. But I do it for the sake of encouraging other people to do it if it's something that's going to, in their case, they're going to be listened to. That's step number one. I mean, that's just part of the democratic process, right?
Mhm.
But I personally do feel like that one of the reasons, and I'm not, this isn't political, this is more of like a civics kind of comment, okay? I think one of the reasons we're in the situation we're in is that people have abdicated their responsibility of being a good citizen, and that means
Mm.
figuring out a way to get involved more than just when you go vote every 4 years or every 2 years or whatever is going on in your local community. To me, democracy is all about getting up every single day and trying to make the world a better place. The way that I choose to do that is be not only my personal advocacy efforts on social media, where I have been since 2012 advocating for PKU consistently and newborn screening consistently. But that's just one part of what I do. Another part of what I do is that I serve organizations. And
Mhm.
the organization I mentioned earlier is the National PKU Alliance. It's one of the organizations that serves the PKU community here in the US. And for me, being involved in that is a way for me to be involved in the democratic process because we are every single day, people are not only trying to, actually engage in legislative advocacy, but, work on finding, raising funds for research and a cure for PKU. That kind of work takes people getting involved. And this is something
Mhm.
I'm obviously passionate about because, it's a cliche, but it's true. Anybody who's ever spent any time in any organization of any capacity that's volunteer based knows that 20% of people do 80% of the work. And so I am extremely passionate about whether it's people in the PKU community, whether it's people outside of that in another rare disease community or metabolic disorders community, or in some way affected by newborn screening, or just the average person has maybe no connection to our communities at all, finding a way to get involved with an organization that fits your core values. Because it's the only way that anything's going to be done. Because if everybody sits at home and just waits for somebody else to do the work, it's never going to get done. And
Mm.
I do get passionate about this because, frankly, I see it sometimes in the PKU community of people who their children were saved via newborn screening, and they're thankful for that. But they don't think that anything needs to be done about this. But it's also because they don't see the impact. They see the test. They don't see the
Mhm.
system. The system is invisible. The system is an abstract idea. The test is a concrete paper reality with blood spots on it. People see that and they don't think about everything else that it takes to get that blood spot test processed and diagnosed and a treatment delivered. And yeah, I just think that people need to realize that we're not gonna get out of we're not going to make any progress or keep the newborn screening system that we have in place if everybody just sits back and waits for somebody else to do a job.
Completely agree. And it's clear that you're passionate about that. You've mentioned that you continue to do this advocacy. You continue to work with these organizations. But I appreciate that you also mentioned there are some frustrations, right? There are some things challenging. Sometimes there's more work than there are people to do it. How do you keep going? How do you encourage people to continue to volunteer and advocate?
I can only share what the reason why I do what I do.
Hmm.
And I'll have to briefly set this up. So in my 20s, I got my start in my career in broadcast journalism. I worked for television news here in Shreveport, Louisiana, at the NBC and ABC affiliates here. And in my time, I covered stories like I started just to give a reference. I started just a few weeks after 9/11, and during my time, I covered the local impact of 9/11 because the president of the United States landed at Barksdale Air Force Base here in town that day. The Columbia shuttle disaster literally happened in our backyard, and I was one of the first crews out of our station to go try to cover that in Toledo Bend, Louisiana. And then there was Hurricane Katrina, and I covered the aftermath of Hurricane Katrina, and I was down there for about a week after the storm. And so obviously I saw things that I'll never forget, but I also saw things I'll never forget working daily news and covering crimes and accidents and other natural disasters. And what I learned is that we cannot control, there's much about life we just can't control. Bad things are going to happen. It happens every single day. Every single day, something happens in everyone's community. It just happens. And we can't always control that. But newborn screening is one of those things we can control. We absolutely can prevent the worst outcomes of conditions like PKU, maple syrup urine disease, or Krabbe disease. We can do something about that if we have the will to do it. And I just personally know that the reason why I keep advocating is because I was granted a life with PKU because of newborn screening, and I'm firmly believe it's my responsibility to make sure that happens for the next generation. And I'm deeply worried and afraid that we're going backwards, and that it's not going to be a given that if you're born in the United States and you have PKU, you're going to be diagnosed. That's my fear right now, and I think it's a
Right.
valid fear.
Yes, I was going to say, I think that that is a valid fear. I think there are quite a few folks that share that fear, and I think it's something that could potentially become a reality, which is why a lot of people are trying to get information out and trying to educate others, but also trying to look at what's going to happen and trying to hold folks that can make a difference accountable.
Yeah, and I think the best thing that people can do with this, I mean, number one, it's you ask what can people do. Honestly, number one is just get informed about it, because people make so many decisions these days without being informed. And this is not a matter of, it's a matter of opinion about how you spend money. It's not a matter of opinion about whether or not PKU causes damage and what the consequences of not having a diagnosis are. That's not debatable. It's not
Hmm.
debatable what happens to a child with MSUD. It's just not. And, the things that I personally will never forget, I will never forget, I travel, my advocacy journey has taken me literally all over the world. I've spoken at, in Europe, I've spoken in South America, I've spoken in Australia. And I've met people all over the world, and people with different experiences with PKU, not just like mine. I'm thinking of a mother from North Macedonia who has a child that's about 7 or 8 years old who was a late diagnosis case, and his life is totally different than mine. And they share the story of people from the nation of Georgia that I'm connected with. We have a high population of adults who are have late diagnosis. And when you hear, and then of course there's the father that I shared already about that guilt in his voice. I don't want for people who don't follow this issue and don't think that it's a big deal. I don't want for them to be the people that 10 years from now are thinking, my God, why didn't I make this choice? Because that's another concern that I have. In Utah and in Nebraska, there are measures right now. Right now, newborn screening is mandatory. It just happens. In those states, there's measures to make it opt-in. And if it's opt-in, it's just not going to happen because people don't know about it. And I don't want to see those parents 10 years from now have that regret of, why didn't I choose this? Because then by that point, they will have understood the consequences, and it will be too late.
Right, right. And I think too with like the opt-in, one, they may not be aware of it, understand what it entails, and it may not be explained properly. There may not be really helpful, relevant information that's given out. Because could you imagine there's a lot happening when you have a new baby, right? So there's a lot going on over those next couple of days. So it's hard to focus, pay attention, and figure out, oh, this is something I should spend some time thinking about and elect to do.
That's why for a long time I've been a big believer that it should be, the phrase I used earlier is part of the popular consciousness.
Hmm.
Everybody, even if you're not like I've never had kids, I'm not going to have kids, but I know about the process and certain things that people go through when they're preparing for giving birth. It's just part of the popular consciousness. Newborn screening should be part of that, and I think it's going to it hasn't needed to be because we've taken it for granted. But if
Yeah.
we can't take it for granted anymore, it's going to be one of those things that you're just going to have to start telling people about. And so, for example, I produced that film about Katie Hayes in 2013, and I've never felt like it's more relevant. And
Hmm.
so I had not shared it much in the last few years, and I've been sharing it a lot recently.
I was going to say, is there a place where we can direct listeners that want to check out the movie?
My website is pkujournal.com.
Okay.
And there's a host of things. I have my videos there. There's a videos tab where I have my film, My PKU Life. I have a video that I'd actually produced in partnership with the Association of Public Health Laboratories also in 2013 that kind of tells the story of newborn screening. And then there's also For Katie. But I also have, articles that I write. I wrote an article recently after all of this called Newborn Screening is a Human Right, something I believe passionately. And then I've also in the past hosted a storytelling podcast. It wasn't an interview-driven podcast, but I told stories about the rare disease community and about the PKU community in the last season, including the first the first family and the first woman who was diagnosed and treated, well, not diagnosed, but treated for PKU in the 1950s in Birmingham in the United Kingdom. And the story of the creation of PKU treatment, but also the story of Dr. Robert Guthrie and the creation of the newborn screening test. And so all of that's on my website, pkujournal.com.
Okay, perfect. And we'll put all of that in the show notes as well so that people can find some of the links as well to National PKU Alliance and some of the other groups that you mentioned. Before we wrap it up, we've covered a lot of ground.
Yeah.
So is there one thing that you would want listeners to remember about our conversation today?
Yeah. So I recognize that PKU is one rare disease out of the host of rare diseases, and that most people, even people who work in the medical community, may never come across a case of PKU. And the average person, may not understand when I talk about my experience with PKU. In the back of their mind, they're probably thinking, okay, that's great, but what do I do with this information? Well, newborn screening affects absolutely everyone. The newborn screening system is slowly being eroded. And so awareness has never been more important.
I appreciate you saying that. And I think that's an important first step is the awareness, but then moving to some of the other action items that you had mentioned. But I think this is an extremely informative conversation. I appreciate you sharing the stories, the real life people that you have met and encountered. And really just thank you so much, Kevin, for being here today.
Well, thank you for having me.
For more information about this episode, visit allaccessdna.podbean.com, where you can also stream all episodes of the show. This link is also in the show notes for easy access. Any inquiries on the podcast can be sent to allaccessdna@gmail.com. Check out our Patreon at patreon.com/allaccessdna and consider donating to get bonus content, submit questions for our guests, and connect with other genetic curious individuals. Note that this podcast is for entertainment and education and is not intended to be a substitute for professional medical advice. Please consult your physician with any questions you may have regarding your health. Please rate and review the podcast on Apple, Spotify, or wherever you listen. This helps other people like you discover the show. All Access DNA is hosted, produced, and edited by Kate Wilson. The logo design is by Designs by NKJ. Thanks for listening and join us next time.